This is my presentation on Klinefelter syndrome. What is Klinefelter syndrome? Klinefelter syndrome is a genetic disorder caused by the existence of an additional X chromosome in males. Klinefelter syndrome is not an inherited disorder, therefore having one child with Klinefelter syndrome does not predispose parents to having subsequent children with this disorder. And I put a picture on this slide so you guys can kind of see what a male with Klinefelter syndrome looks like. Manifestations of Klinefelter syndrome. There's many manifestations. I just posted the most prevalent ones for the physical symptoms. So the male with Klinefelter syndrome will have occasional gynecomastia, abnormal body proportions, small soft testes, underdeveloped sex characteristics, reduced fertility, reduced body and facial hair, lower levels of testosterone, and a taller than average stature. Also, there is cognitive impairments as well. So the males with this syndrome usually have a lower IQ than normal males. They also have mild intellectual impairment and problems with reading and writing and also math. How is Klinefelter syndrome diagnosed? It can be diagnosed in utero by an amniocentesis or chorionic villus sampling. It's often not diagnosed in utero though. It usually gets missed until adolescence. Once they're in adolescence, they can do blood and urine sampling, and those will indicate abnormal hormone levels. Chromosome analysis can also be done, and it's also called a karyotype, and that's used to confirm the diagnosis of Klinefelter syndrome. Treatment. The most common treatment is hormone therapy. Testosterone injections are given usually around the age of puberty, and these do not impact fertility. Men with Klinefelter syndrome have low fertility, so they'll need fertility treatments. These men are most likely not able to produce sperm. If the male does have sperm, the sperm can be removed and put directly into the egg. Speech therapy is also used because these males have speech problems. Occupational therapy improves physical, mental, and behavior problems associated with Klinefelter syndrome. Progression and outcome of Klinefelter syndrome. One of the first signs of this syndrome is delayed development. The patient will not be hitting milestones that need to be met for certain ages. The sooner the child is diagnosed, the better the outcome. Men diagnosed with Klinefelter syndrome have a life expectancy of about 5 years shorter than the average male. This is due to an increased risk for stroke, respiratory disease, heart disease, and breast cancer. And these men, like we discussed before, also have problems with infertility. A nursing diagnosis that I chose was disturbed body image related to alteration in body structure and alteration in the view of one's body as manifested by a negative feeling about the body. Interventions for the nurse to do with the patient are the nurse will include cognitive behavioral therapy to assist the client to express his emotions and feelings. The nurse will provide clients with a list of appropriate community support groups. The nurse will discuss treatment options and outcomes for the patient diagnosed with Klinefelter syndrome. The nurse will assess for symptoms of social withdrawal, limited eye contact, and expressions of low self-esteem. These males with Klinefelter syndrome have a lot of abnormal physical characteristics, so they may be really insecure about their bodies. So it's very important to let them express their feelings and listen carefully to their feelings. Education. The parents need to be educated on emotional support for the child. The child may have anxiety about certain things that come with the syndrome, such as body image disturbances. The child may need to see a therapist to deal with the issues that come with the syndrome. The family needs to participate in care and emotional support as much as possible so the child does not feel alone. The parents of a boy with this syndrome also need to be educated on all the treatments so the child can get all the proper help needed. What have you learned so far? So this is the NCLEX question that I chose. What are the manifestations of Klinefelter syndrome? Select all that apply. Webbed neck, clubbed fingers, long stature, absence of facial and body hair, low testosterone, and gynecomastia. So the answer to the previous question is 3, 4, 5, and 6. They will have low testosterone, they'll have a taller than average stature, they'll have not a lot of facial hair or body hair, and they also have gynecomastia. And these are all manifestations of Klinefelter syndrome. Is Klinefelter syndrome inherited from the parents to the child, true or false? So this would be false. As we discussed earlier, it is not an inherited disorder from the parents to the child. There are no associated risk factors for the syndrome. And these are my references. Thank you.